Hello. Today's topic is about Rubberdam. It's one of the isolation methods. It's very common and commonly used in a clinical side, and it's become very popular since uh, the 1864. It was introduced into dentistry in the year 1864 by a New York dentist, uh, Sanford Christie Barnum, or S.C. Barnum, commonly called. Uh, it was a very great invention of that time because all the infection control, the safety of your treatment procedures all had improved to a great extent after the introduction of Rubberdam. It was in 1875, Dr. Delos Palmer introduced a set of 32 clamps. Then later on, these clamps number of clamps were reduced, and one a single clamp was used for multiple purpose. So the developments happened. Lots of developments happened after that. But these are the history part. When you talk about the history part, these are the names that should be remembered. Dr. Delos Palmer. And it was Dr. Ainsworth in 1879 who introduced the Rubberdam punch. And it was Dr. Young in 1901 who introduced the metal frame. These are the common popular names to be remembered. And now, what are the advantages of using Rubberdam isolation? We'll come to that. The Rubberdam, by using Rubberdam, it acts as a raincoat to the tooth. What do you mean by that? It covers the tooth. The tooth in question you're going to treat is isolated from rest of the oral cavity, so that the oral fluids or any solution you're using on the tooth or any chemicals you're using on the tooth is confined to that tooth alone. It doesn't cause any caustic effect on the neighboring tooth or the soft tissue. And similarly, the saliva do not interfere, the oral fluids do not interfere in your work. So that is a primary advantage of using a Rubberdam. It acts as a raincoat for the tooth. Second, complete long-term moisture control. The moisture control from the oral cavity or from the surrounding areas are protected from affecting the tooth or your work. So for a long period of time, you can commonly earlier the cotton rolls and wafers were used to protect moisture, but that when it gets soaked, you have to remove it, change it. But by using Rubberdam for a longer period of time, you get control of moisture. Then it maximizes access and visibility. When you isolate a tooth with a Rubberdam, only that tooth is in the focus of your mission. So you get maximum access and maximum visibility. Your surrounding tissues all are retracted away from the site of operation. Then only that tooth is in focus. So you see that tooth in greater detail. And also the soft tissue, tongue, cheek, buccal mucosa, all that is separated away from the tooth of question, so you get maximum access. And another advantage they say is the clean, dry feel while working. So when you isolate the tooth, that tooth is it is dry. It is very dry. It is a very clean area, so you can work better when the area is clean and dry. Then it protects the lip, cheek, tongue from by keeping them aside. Not alone retraction, it moves the cheek, tongue, and lip away from the site of operation, so you get better access. Not alone that, it also prevents harmful iatrogenic trauma. That is, while working, your burr can accidentally hit the tongue or cheek or lip when it is in the area of work. But when you use a Rubberdam and isolate the tooth, the tongue, cheek, and lips are moved away. So your burr accidentally nicking or your hand instruments accidentally causing trauma to these soft tissues are prevented to a large extent. Then it also prevents accidental swallowing and aspiration of foreign bodies. when the tooth is isolated with the rubber dam, if accidentally your burr or your hand instrument, your file or something slips from your hand, it falls into this rubber dam isolated sheet. It doesn't fall into the patient's throat, or the patient doesn't accidentally swallow that instrument or whatever. Even the chemicals that are placed, like irrigating solutions, when you're doing an endodontic treatment, when they're placed on the tooth, they do not flow into the oral cavity, causing irritation to the soft tissue or burns on the soft tissue. That is a very great advantage of this rubber dam. Then infection control. Next aspect is the infection control. It protects the patient from, it protects the operator from the, if the patient is having any airborne disease like tuberculosis or any diseases that can be communicated by the air, even the oral fluids, to a large extent, it can be prevented when you use rubber dam. So, infection control, it has a great role in communicating disease from the patient to the operator, even vice versa. Then it increases the accessibility of the operating site. When the tooth is isolated and it's only in focus, the operator has a greater access to that tooth, or his soft tissues, all that are retracted away from the site. So better vision and access, your instrument can reach all the commonly inaccessible areas. Then improved properties of the dental materials. Now, when you're using the dental materials, if saliva gets contaminated with the material, the property of the material is reduced. Or if you're not able to obtain a very dry feed, the property of the dental material you're using is going to be affected. So when you use rubber dam, isolate the tooth well, the properties of that material, which can be composite material, it should always be done in a dry field. So you get the best properties of the material you are going to use. Then improved visibility and less fogging of the mirror. When the rubber dam is used, the hot air from the throat doesn't come and fog your mirror, so you get the best vision or visibility on the mirror, and the fogging of the mirror is not happening, and it prevents contamination of the tooth preparation. When any blood or any tissue lacerations that can contaminate your cavity preparation or your tooth preparation. So this is also prevented by using the rubber dam. Next, you're coming to the disadvantages of using rubber dam. Disadvantages are very little, very near. So you can neglect them also. Like the main disadvantage is time taken to apply a rubber dam. It takes a little time, a few minutes, 1 or 2 minutes it takes to apply rubber dam when you're regularly using it. Then that time actually it's not of much significance, because it's just the time taken for the onset of it. You give a local anesthesia to the patient, and by the time you get the effect of the anesthesia, you can place the dam. So that is not a great disadvantage. And second is communication with the patient can be difficult. So that is a problem. The patient cannot talk with this rubber dam in position. So you'll have to communicate, discuss with the patient before placing the rubber dam. What all you want, what all the patient wants to communicate to you, all that is discussed before you place the rubber dam. And once the rubber dam is placed, your discussion with the patient should be limited. Not limited, it should not happen. Okay, then incorrect use may damage porcelain crowns or gingival tissue. That if you place the rubber dam well, considering the crowns of porcelain, this gingiva don't place the prongs of the clamp onto the gingiva so that it can last. If you're a little careful, this disadvantage can also be of less significance. Insecure clamp can be swallowed. All these if you place the clamp properly or check the clamp before you check the stability of the clamp, all these disadvantages can be avoided. Next, Rubberdam isolation. In which all condition is it contraindicated? Rubberdam should not be used in which all condition. One is asthmatic patients. Patients who are asthmatic, they have difficulty in breathing. So when you place a Rubberdam, it becomes more difficult for them. In these conditions, it's better to avoid Rubberdam. Then patients who are allergic to latex. Yes, these patients who are allergic to latex, you have nitrile dam sheets, latex-free sheets, so that can be used. Then to an extent, the Rubberdam napkin can be used in between the Rubberdam. You can prevent to some extent, but it is better to avoid Rubberdam if the patient is allergic to latex. Then same mouth breathers, those people who have some nasal obstructions, who cannot breathe through the nose well. If placing a Rubberdam will increase their problem of breathing. So these patients also, I think it is better not to use Rubberdam. Then certain tooth which are malpositioned, extremely malpositioned. In those cases, to place a Rubberdam may be a little difficult. So you may have to have a compromised treatment of compromise, placing the Rubberdam, split dam technique, or any modified techniques you can use to place the Rubberdam. Even in some third molar tooth, which is not erupted fully, where you cannot place the clamp onto the tooth. Yes, these patients, you may have to use some modification or modified method of Rubberdam placement. And epileptic patients also, you should be careful when you're using Rubberdam, because these patients, if at all they have a seizure while the dam is in position, to remove the clamp and the dam from the patient's mouth, it would be difficult. So always keep the clamps tied with the floss, with the large floss. In case the patient has to aspirate the clamp can be retrieved using this Rubberdam floss. In certain psychological reasons, sometimes the patients cannot tolerate the Rubberdam placement in their mouth. So these cases also, you may have to avoid placing a Rubberdam. Now coming to the armamentarium, you have some armamentariums which are used to place the Rubberdam. So coming to the first one, that is the Rubberdam sheet. Usually the Rubberdam sheet, you can see the picture. It is a rubber latex sheet, usually 4 into 4 inch or 5 into 5 inch dimension. Then second, second, you have the Rubberdam clamps. These are the clamps to hold the Rubberdam sheet in position on the tooth. You have the clamps of different sizes, different types. We'll talk to that. We'll talk about that in coming slides. Then next one, you have the Rubberdam forceps. These are the forceps which are used to carry the Rubberdam clamp and place it onto the tooth structure. Rubberdam forceps also, you have a few different types of Rubberdam forceps. Then you have the Rubberdam frame. Rubberdam frame, You have metal frames, you have plastic frames, you have oval shaped frames, you have foldable frames, different types of frames. So you have these are to hold or position the rubber dam sheet stretched over the mouth. Then you have the rubber dam punch. The rubber dam punch is used to punch holes on the rubber dam sheet. So the punch is used to punch the hole. So different sizes of holes on the sheet according to the tooth which you're going to treat. Then apart from these basic components, armamentarium, you have the accessory components. They are the petroleum jelly, which I use to lubricate the rubber dam punched holes so that to place it or to insert it on the tooth becomes easier. Then you have the dental floss, which I use to push the sheet in between the contacts to tie the sheet in position. You can use the rubber dam floss. Then you have the rubber dam napkin. This is what I was talking to earlier. In allergic patients, to some extent, you can prevent the contact of rubber with the or soft tissue or the oral tissue by placing this rubber dam napkin in between the dam sheet and the oral cavity. Then, okay, coming to the rubber dam sheet, talking about the rubber dam sheet. I told you the dimensions are 5 into 5 inch or 6 into 6 inch size. Usually these are the two common sizes which are available. It can be latex or non-latex sheets. Latex are preferable because it stretches well and adapts to the tooth better. Non-latex sheet, vinyl sheets are also available. Where latex allergy patients, you can use a vinyl sheet. The rubber dam sheet is a single-use material. You use it on a patient, and after that, you'll have to discard it. You cannot reuse it or sterilize it. So it is a single-use material, and it comes in 4 different thickness. That is, the thin one, it is 0.15 millimeter in thickness. Then you have the medium, which is 0.2 millimeter in thickness. Then you have the heavy, which is 0.25 millimeter thickness. And you have the special heavy, which is 0.35 millimeter. Usually the thin ones are very less used because when you stretch, chances of tearing is very high. So what you do is in a very tight contact teeth, the tooth have a very tight contact. In these teeth, you can use a thin one. And medium and the heavy ones are the commonly used ones, regularly used ones. Special heavy ones are thicker sheets. Usually in tight contacts around, these thicker special heavy sheets are difficult to use or pass through the contact. But in case of a very dense, thick gingiva or very you want gingival tissue retraction, then in those conditions you can use the special heavy ones. So the commonly used one I told you are the medium and the heavy. Medium, most commonly used is the medium size sheets, 0.2 millimeter thickness sheets are used. Then these sheets usually come in contrast colors. Light color sheets are less commonly used, but commonly the dark color, usually it comes black, blue, green. These are the dark color sheets. Dark color sheets are used because they have contrast color to the tooth, white color of the tooth. So when you do any restoration procedures or any treatment procedure on the tooth, when the background is a contrast color, you can see or visualize the tooth better. So usually you use contrast color sheets. Then the sheet has 2 surfaces. One surface is a dull side and the other side is a shiny side. Usually the dull side is placed facing the operator because the reflecting light is reduced. So the dull surface of the rubber dam sheet should face the operator when you place the rubber dam sheet in the mouth. So that is about the rubber dam sheet. Now coming to the next accessory is a Rubberdam frame. I told you, this Rubberdam frame, frame maintains the border of the dam in position. That is, after placing the Rubberdam sheet and clamp into the oral cavity, to stretch the Rubberdam sheet outside the mouth, you use a Rubberdam frame. It supports the edge of the Rubberdam. On the Rubberdam frame, you can see small pointed ends. These pointed ends are used to attach the Rubberdam onto the frame. The Rubberdam frame retracts the soft tissue to some extent. They are available as told you, plastic or metal. Plastic frames are used when you want to take radiograph with the frame in position. Then metal frames, they interfere with X-rays. Then you have oval shaped frames, the U-shaped frames, young frames, frame. Then you have foldable frames. When you want to take radiograph, you fold the one half of the frames. So these are the different variety of frames which are available. Yeah, this is the picture of a plastic frame. Now coming to the Rubberdam punch. Rubberdam punch is used to make holes in the sheet through which the tooth can be isolated. So the Rubberdam punch, the working end is designed with a plunger on one side and a wheel on the other. Okay. Okay, this is the Rubberdam punch. I just tell you the parts of the Rubberdam punch. You have on one end of the tip, you have a plunger, a pointed metal end, and the other end you have a round wheel. On the round wheel, you have 6 different size of holes. So the plunger is used to make holes. You select the size of the hole you require by rotating the wheel on the other end. Usually the smallest hole is used for lower incisors. The second larger holes are used for the upper incisors. The next is used for premolars. Then you have for molars and upper molars and lower molars. The largest hole is used for any extra large tooth or any malformed tooth. Use the largest hole. And these Rubberdam punch, you have different models. The picture on top is the ivory type, and the lower one is the Ainsworth type of Rubberdam punch. Yeah, this is the rubber. This is the different size of holes I was talking to you of. You have 6 different size of holes. Lower one is for the smallest one is for lower incisor. Next is for upper incisor. Then in next larger one is for the premolars and the canines. Then the other one is used for upper and lower molars, and the largest one is used for any extra large tooth or lower first molar. Next, you have the Rubberdam clamp. Rubberdam clamp, they are used to secure the dam to the tooth that can be that had to be isolated. This Rubberdam clamp holds the dam onto the tooth, position the dam well onto the tooth. So once you place the dam, or it can also be used to carry the dam onto the tooth and in the stretched position. So they also minimally retract the gingiva. This Rubberdam clamps, they move the gingiva also a little bit away from the site of the isolated area. Then when you how do you classify Rubberdam clamp is? This is the picture of a Rubberdam clamp. This is the anterior clamp. Now I just talked to you. This is the picture of a posterior clamp, and the parts of the Rubberdam clamp have one for a posterior clamp, you have one single bow with two jaws. On each jaw, you have two prongs, the two pointed ends of the jaw, which comes in contact with the tooth, are called the prongs. Then in this clamp, you have a projection on the lateral side. That is this projection on the lateral side is called the wing. And that is called the wing, and in the center you have a hole, which is the perforation used to carry the clamp. Then some clamps you have the anterior wing also, that is used for additional retraction. This picture on the lower this is the anterior clamp. For an anterior clamp, you have two bows, two jaws, and four prongs. So this it's also called a butterfly clamp. It's used for isolating the anterior teeth. Now, winged and wingless clamps are used for different techniques of rubber dam placement. The winged clamp, you use it for carrying the dam along with the clamp onto the tooth. For wingless clamp, you place the clamp first on the tooth and then place the dam over it. So these are the different techniques. We'll come to that later. Then you have clamps which have inverted jaws. So when you want additional retraction or more amount of retraction, you use the clamps which have the inverted jaws. Now coming to the rubber dam template, it is an inked rubber stamp which helps in marking dots on the rubber dam sheet according to the position of the tooth. So rubber dam template can be of two types. One is the inked rubber stamp, just like your rubber seal. Yeah, on the right side you can see this is a picture of a inked rubber dam seal. So you just like how you apply the seal onto the paper, you dip the template on the pad, and then press it on the rubber dam sheet. So you can mark the tooth, a punch hole on the tooth which you're going to operate. Similarly, you have a template, a metal template. The picture on the left side shows the rubber dam template. It's usually 6x6 inch size. So this is placed beneath the rubber dam. Rubber dam sheet is placed above this, and you mark the hole or mark the tooth which you're going to punch the hole, and then you can place the punch over that area and then punch it. So that is about the rubber dam template. Now coming to the other accessories, you have the flossing agents for rubber dam and tight contact area. This is a regular rubber dam floss, or you can use rubber dam tape. Rubber dam floss tape type, a broader one, which I use to push the dam into the contact area, and also to tie the dam, tie the tooth so that the dam doesn't slip out of the tooth, which are not isolated by the clamps. And it also can be used to tie the clamp, so if at all the clamp fractures or slips into the oral cavity, it can be retrieved by pulling the floss. Then you have the rubber dam napkin. As I told you, it's an absorbent paper, absorbent material, which is placed in between the rubber dam sheet and the skin. It has two main advantages. One, it prevents the contact of the rubber dam sheet with the oral soft tissue. So some amount of rubber irritation on the mucosa can be prevented. And second, since it's an absorbent paper, saliva drooling out of the mouth is absorbed by this sheet. So the saliva drooling out of the mouth is absorbed and doesn't flow outside. So that is the function of this rubber dam napkin. Then you have the lubricant. Usually it is petroleum jelly. The lubricant is applied on the area of punched hole to facilitate the passing of the dam septa through the contact points. So in the contact area, you apply this lubricant jelly onto the punched hole, and then when you pass it onto the tooth, it moves freely into through the contact. Now coming to the applications of Rubberdam, how do you apply? How do you apply the Rubberdam? What are the different techniques in Rubberdam application? I think I'll continue in the next class. Okay. Thank you.